Good afternoon. My name is Lordeen Kordel Card, and I'm a registered dietitian at Beaumont Hospital, Troy. And it is my pleasure to be here today to talk with you about diabetes and how ironic is it that we're talking about this in November, which is Diabetes Month. So what's the big deal anyway about being informed about diabetes? It's important to know that over 29 million people in the United States have diabetes and 25% are not aware. Of that 29 million, 25% of those are seniors, 65 and older. Also, there are 86 million people who have prediabetes. Now, there are many causes of diabetes, but only 3 that are out of our control. Those are our family history, our age, and ethnicity. The other ones we can control with a healthy diet, a good normal weight, and exercise. That will really help with high blood pressure, cholesterol, and elevated blood glucose. Diabetes can also be caused from exposure to certain viruses. Also, it can be drug-induced if people are on large doses of steroids, for example. And women who have had gestational diabetes would be at much higher risk for developing diabetes down the road. And if they've had a 9-pound baby, that too increases the risk. And then women who have polycystic ovarian syndrome are at risk too. Now, the diagnostic criteria for diabetes is one of 3 things: a fasting blood sugar equal to or greater than 126 on 2 separate occasions, or a random blood sugar that is equal to or greater 200 milligrams per deciliter on 1 occasion with 1 or more symptoms of diabetes. And lastly, an A1C equal to or greater than 6.5%. Now, the diagnosis for prediabetes would be a fasting blood sugar between 100 and 125, or a random blood sugar between 140 and 199, or an A1C of 5.7 to 6.4. Now, prediabetes is the newer term for borderline diabetes that we heard about for years. And unfortunately, people can have prediabetes for many years and not know it. Perhaps they don't go to their healthcare provider on a regular basis, or perhaps they haven't been notified that their blood glucose is gradually increasing. But when one is told they have prediabetes, it's their warning sign that they need to lose some weight, get on a healthy diet, and get off that couch. There are many signs and symptoms of diabetes, but not everybody gets them. The most common would be excessive thirst, urination, and hunger. Also, just feeling really fatigued and weak, having delayed healing, perhaps frequent infections, very blurry vision, and some people lose weight. Diabetes is actually a very complicated disease, but more simply put, it's when the pancreas is not making enough insulin to meet the body's needs. Perhaps you've gained a lot of weight and there's more body cells that need to be fed. Or it can be the pancreas making the insulin, but that insulin is not taking the glucose from the blood, carrying it into the body's cells for energy. Most often, it's a combination of both. Now, there are large differences between type 1 and type 2 diabetes. Up until recently, type 1 was generally found in young children, adolescents, people in their 20s. Now we're seeing type 1 in adults in their 30s and 40s. Type 2 was typically diagnosed in the population being 40 or more, but now we are seeing it, unfortunately, in children and adolescents, also young adults, because of the problem of obesity that we have here in the United States. Now, typically, people with type 1 are thin, but those with type 2 are overweight. The symptoms appear very suddenly when you have type 1 and more slowly with type 2. With type 1, those people have a pancreas that makes no insulin, so they are completely dependent upon injectable insulin or the insulin pump to survive. With type 2s, their body is still making some insulin, but again, maybe not enough, maybe it's not being used correctly, so they're not always on insulin. Sometimes they start off diet control, sometimes medication, and down the road, they may be on insulin. So what happens after you find out you have diabetes? Well, going to an extensive diabetes self-management class would be a great idea, because that way you will learn all about diabetes, good nutrition, the importance of exercise, and medication. Coming to see a dietitian is a great idea because you will learn the importance of losing weight or maintaining it, and doing it in a way that you can spread your carbohydrates evenly over breakfast, lunch, and dinner and snacks for best blood sugar control. You'll learn that exercise really is important. The American Diabetes Association recommends a minimum of 30 minutes on most days, which would be 5 days a week. And walking is a great exercise. That exercise will burn the glucose in the blood, helping to keep your levels at a better place. Medication. Your doctor may prescribe medication for you. It's very important to take it as prescribed. I always tell my patients, look at a triangle because your treatment falls on there, with diet, exercise, and medication all working together to give you the best blood glucose control. Smoking cessation is very important, and glucose monitoring. I hear patients every day tell me, why should I check my blood sugar? I don't want to pick myself. I don't want to spend the money on the strips. Why do I really need to do this? I tell them it's the only way you know if your diet, exercise, and medication are working to control your blood sugar. So if they haven't been told anything specifically by their healthcare provider, I will suggest that they check their fasting blood sugar. That would be first thing in the morning without food or drink. I would also suggest they check their blood sugar 2 hours after the start of a meal, but rotating the meals between breakfast, lunch, and dinner. Now, after one checks their blood glucose for a few weeks, they will see a trending appear. They may find that their fasting blood sugar is always normal, but they may find that their 2-hour reading after lunch is elevated. So then it's a problem-solving situation. Why is this happening? The first thing they might want to address, did they eat what they should for lunch, or did they overeat? What about exercise? If they have a sedentary job, maybe they've been sitting all afternoon, and that could be the cause of the elevated blood glucose. And lastly, have they been taking their medication correctly? Without problem solving, checking your blood glucose is a waste of time and money. You want to take that information and improve upon your lifestyle. So when you're checking your blood glucose, it's important to always wash your hands first. If you've just had a banana for a snack and you're checking your blood glucose, you're checking the sugar in the banana. You'll get a false reading. So wash your hands, and then when you monitor your blood glucose, you're going to alternate the sites using the 3 middle fingers and checking the blood glucose by inserting the needle on the sides of the finger, not in the middle. And Once you get that number, you want to document it. Have a logbook that you can keep with you at all times. It's a really good idea to take that information and your glucometer to the doctor so that he can look at your numbers and make adjustments in medication if that's what's needed. I often hear people talk about, that's my number, and in asking them what do they mean by that's my number, I find out they are referring to their hemoglobin A1C, or usually called A1C. And this is a lab value that's done. It takes into consideration your blood glucose 24 hours a day, 7 days a week for 3 months. So it's a long-term measure of your diabetes control. And we like to see that number under 6.5. Now, why is it so important to have good blood glucose control? Because that will help to prevent or delay the onset of diabetic complications. When one has diabetes, they are at a 2 to 4 times greater risk for developing heart disease or for having a stroke. And it's the small blood vessels and the large blood vessels that are affected by these high sugar levels. People don't really understand that. So in my office, I have 2 test tubes, one that's filled with blood with a normal blood sugar consistency and one that has elevated blood sugar. So when you turn it upside down, you can see that the normal test tube has free-flowing blood, and the test tube that has the high blood sugar in it is very thick, very gooey. I often describe it as maple syrup running through the blood vessels, and that's what causes all the damage. Now, some people are bothered with high blood sugars and low blood sugars. Hyperglycemia is high blood glucose, and that is when there is more glucose and less insulin in the blood. We're looking at blood glucose values over 240 milligrams per deciliter. Low blood sugar or hypoglycemia is too little glucose and too much insulin, and generally a blood glucose below 70. Now, the signs and symptoms of high blood sugar and low blood sugar are very similar. So for that reason, it's very important to check your blood glucose if you're not feeling well. If you're starting to feel shaky, jittery, you can't concentrate, check that blood glucose so you do the right treatment. If the blood glucose is high, it's important to drink a lot of water. You want to really hydrate yourself, drink calorie-free beverages so you can dilute the blood. Continue to take your diabetes medications as prescribed, and if after you test your blood glucose, your levels are above 240, it's time to call your doctor. Now with hypoglycemia, you're running blood sugar 70 or below, or you just may be symptomatic. That could happen if you're a person who tends to run higher sugar levels. As you're coming down, you might feel symptomatic. So if you're feeling that way, you want to have 15 to 20 grams of carbohydrate. Examples would be a half a cup of juice or regular pop. This is the time you get regular pop, not diet. It isn't going to help to bring that glucose back up. Or you might have 8 ounces of milk, a half a roll of Lifesavers, or 2 to 3 glucose tablets. Wait about 15 minutes, check your blood glucose again. If it's starting to come up and you feel better, follow that with a snack that contains protein and carbohydrates. A great example would be peanut butter and crackers, cheese and crackers, or an apple with a cheese stick. If, however, you don't feel better, you want to retreat, another glass of juice, pop, milk, glucose tablets, wait 15 minutes, retest, followed by a snack. If at that point you're still not coming out of hypoglycemia, it's time to call your doctor. Now, again, problem solving comes in here. We want to know, why was your blood sugar low, or why was it high? In the case of hypoglycemia, you would want to look at your food intake. Did you skip a meal? Did you not eat enough of that meal? Did you do a lot of extra exercise or activity that you wouldn't normally do that would be burning sugar in your blood? Or did you take too much insulin or medication? So it's very important to problem solve whether it's high or low blood glucose. Now, the long-term complications of diabetes can be prevented or delayed with good blood sugar control. Retinopathy, neuropathy, heart disease, those are a few of the problems that we see. Neuropathy is the leading cause of kidney failure that leads to dialysis in the United States. And the first sign is protein spilling into the urine, tested with urine microalbumin. Now, if a patient finds out that their kidneys are starting to fail, with excellent blood glucose control, blood pressure control, and medications, they can help to slow that down or prevent any progression. Retinopathy is the leading cause of blindness in the United States, and the risk is increased each year that you have diabetes. It's important to get that yearly eye exam to have the eyes checked to see if there's any problems that are starting. And there are treatments available if that is the case. Neuropathy is the leading cause of leg amputations in the United States. Patients might feel numbness, tingling, burning, or other sensations of the hands and feet. Also, there's a condition called gastroparesis, and this is slow emptying of the stomach. So the food contents will sit there for long periods of time, causing nausea, vomiting, or diarrhea. Neuropathy can cause foot ulcers, deformities, also problems with urination. Neuropathy can cause blood pressure to drop quickly upon standing, but it too is prevented or improved with excellent blood glucose control. Cardiovascular disease is what causes the heart attacks, the strokes, and unfortunately 65% of people who have diabetes will die of a heart attack or a stroke, not from diabetes. So it's just very important to have that tight control to try to prevent this. In summary, monitoring your diabetes is so important. Checking your blood glucose every day or most every day. Having that A1C done every 3 to 6 months. Have your blood pressure checked at every visit. Show your doctor your feet. Say, look at my feet. Make sure they're okay. But you too can be checking your feet at home, because if you have a blister and you have neuropathy, you wouldn't feel the blister. It will continue to get bigger and bigger and cause a problem. Make sure that you get a yearly eye exam, you have blood work done for cholesterol, a flu shot, and a pneumonia shot when it's scheduled. Again, the best way to keep everything in control, follow that meal plan, exercise daily, take your medication as prescribed, and that will help to make you the best controlled diabetic possible. Thank you very much for your time. It was my pleasure to talk with you about something that's very important to me, and that is how to control diabetes. Thank you.
you.